Welcome to QAPI Essentials for Building an Effective Program. This training module was created for all Bethesda employees in collaboration with the Compliance Store. Our learning objectives will be to describe and understand what QAPI is, explain the 5 elements of a QAPI program, understand what plan, do, study, act means, understand what an RCA or root cause analysis is, and be able to initiate a performance improvement project or PIP when necessary. QAPI is required by Centers for Medicare and Medicaid Services, also known as CMS, to maintain quality and safety in nursing homes. Let's break it down into all its parts so we can gain an understanding of what it is. QAPI is QA, quality assurance, plus PI, performance improvement. Quality assurance means that we meet the basic standards of care, or we are in the process of working towards expected standards. Performance improvement is a constant study of processes to locate areas of opportunity. QAPI is an organized, widespread, and data-driven approach to identify problem areas for improvement. It helps us to provide consistency of care, to simplify processes, work more efficiently, and reduce errors. The overall goal of QAPI is to improve the quality of life for all nursing home residents. Federal guidelines state that communities must conduct QAPI meetings regularly and maintain a QAPI program that focuses on care outcomes. F865, 866, 867, and 868 are F tags specifically associated with deficiencies in QAPI. You may not need to know what each of those tags means. Just know there are rules about how we set up our QAPI program. Each nursing home must gather a quality assurance assessment committee made up of staff from every unit or department. They must have a written QAPI plan that describes how they will conduct QAPI to maintain acceptable levels of performance. They must also have QAPI training for staff. Lastly, each community must have an infection preventionist responsible for tracking infections in the building. Who is your infection preventionist? The infection preventionist is the director of nursing, or person that is designated to track all resident infections. He or she tracks resident and employee infections and supports workplace practices to prevent the spread of infection, such as hand hygiene, isolation precautions, and using clean techniques. On June of this year, QAPI guidance expanded in more detail to ensure that communities have an expansive written QAPI plan that identifies and addresses quality and safety and involves staff and residents in quality and safety. The QAPI plan should include 5 elements or components, which we will talk about next. Let's talk about the framework for building a QAPI program. A framework is a guide that we go by to develop a QAPI program. The CMS QAPI framework is made up of 5 elements. We will discuss each element in more detail in the next slides. The first element, design and scope, means that the program will address aspects of resident care. Aspects of care means things like nutrition, customer service, dining services, laundry and medical care, etc. It also sets measurable goals. The second element, governance and leadership, means that each nursing community will provide oversight and make sure resources are available to conduct QAPI. Leadership will hold monthly QAPI meetings and ensure they are structured and organized at all times, even during transitional phases. Leadership will identify and prioritize opportunities for improvement. Also, leadership will initiate corrective actions and set clear expectations. The third element is about monitoring of data. There should always be systems in place to collect data. Some systems are feedback systems where input is collected from residents, families, and staff. Other data is collected to monitor performance indicators, such as rehospitalizations, infections, falls, and wounds. Included in the monitoring of performance are adverse events. These are accidental events like med errors, employee injuries, or delay in patient care that happen even when we do our best to prevent them. It's important that these be reviewed by the QAPI team so that processes can be improved to prevent further adverse events. Element 4 consists of performance improvement projects, or PIPs. PI makes up a large portion of QAPI and should be conducted at least annually. You may have been involved in a PIP project, since these can be focused on any aspect of care, customer service, or safety involving all departments. PIPs focus on improving problem-prone areas. They should be initiated when a pattern and decreased quality is identified. A pattern means that several data points collected over time show that improvement is needed. This may be captured through audits or through resident or family feedback. Element 5, systematic analysis and systemic action, breaks down a process into its components to make an organized plan for improvement. This is done to ensure that process changes are having a positive impact on quality of care. PDSA stands for Plan, Do, Study, Act. PDSA allows teams to make a plan based on what they believe is the root cause of the problem. It enables them to carry out the plan and collect data. After the plan is carried out, the data is studied to determine if an improvement has been made. Acting on the findings of their study, teams will either enact the new process across the board or make small changes to tweak the process and repeat the PDSA cycle again. An example of a PDSA project is outlined below. A community has the need to find a new incontinence brief. They have identified a brief they would like to trial in their skilled nursing building. A committee of people has been selected to plan how the new brief will be tested. After a plan is laid out, the community carries out the brief trial on one unit of the building, collecting data from employees and residents on the comfort, ease of use, and performance of the new brief. The data over time is studied and analyzed. If the committee is satisfied with the performance of the new brief, they will act by changing to the new brief in all the neighborhoods. If the results don't show improvement, they may decide to trial a different brief and repeat the PDSA cycle. Now let's discuss the Quality Assurance Assessment Committee. What is this and who is required to be on it? A QAA committee is the backbone of the community's QAPI program. The QAA committee is responsible for developing the community's QAPI plan and setting priorities for performance improvement projects. Certain members of the team are required to be on QAA. These include the medical director, the DON, an infection preventionist, and at least 3 other leaders. Much of the time, representatives from all departments attend. The QAA committee typically meets monthly. They keep minutes of their meetings as well as agenda and progress reports. Surveyors that monitor a community's compliance to QAPI are interested in how the QAA committee knows when an issue arises in any department. During the QAPI meeting, there is discussion and feedback on new issues that arise. It's important to know that you have a voice to share your concerns and ideas for process improvement with your supervisor or department head. The QAA committee will then prioritize what issues to work on. The QAA committee will design the follow-up plan. Some issues are easily corrected through a change in process, while others require continuous monitoring throughout the year. The QAA committee also follows issues of abuse, neglect, and exploitation. Therefore, all of these types of incidents need to be reported to members of the committee. A review will be done to look at risk factors contributing to the incident and what may need to be done systemically to help prevent similar situations from happening in the future. This includes education of staff, employees, and residents, as well as process changes. The next slides will teach you what a QAPI plan is and how these are developed. The written QAPI plan will guide our organization's performance improvement efforts. It is intended to assist us in achieving what we've identified as the purpose, guiding principles, and scope for QAPI. This is a living document that we continue to refine and revisit. CMS recommends certain components be included in the QAPI plan. These include how the QAPI program is designed, how we will collect data on our performance, how we will identify where we need improvement, who is overseeing the program, and our process for making sure we are meeting standards of quality. As soon as we realize we are lacking in meeting standards of quality, we initiate PIPs, or Performance Improvement Projects. Everyone involved with resident care should know what the PIPs are in their community. It's also important that the residents know about the PIPs and be given a chance to provide input and feedback. A PIP project is focused on one area of care. The goal of a PIP is to make improvements as needed and sustain the improvement, continuously monitoring for success. Great ideas for PIP projects include any area of care that impacts the health and safety of residents. Examples might be tracheostomy care or pressure ulcer prevention. Areas of care that affect a large volume of residents, such as transcription of orders, medication administration, or lab testing. And areas that have been problem-prone in the past, such as call light response time, staff turnover, or items missing in laundry. At the beginning of a PIP, a written document called a PIP charter is created. This charter outlines the project, sets goals, a timeline, what data will be collected, and team member responsibilities. On the PIP team, there is a leader that organizes the team and reports back to the QAA committee. The members of the team are actively involved in the PIP and may be from more than one department. When the PIP team is assembled, they will meet together and make SMART goals for the project. SMART is an acronym that helps us remember all the important aspects of making successful goals. S stands for specific. What exactly is the goal? Who does it involve? And what location does it impact? M stands for measurable. What data will be collected? A stands for attainable. Is the goal realistic? R stands for relevant. Does the goal address the problem at hand? And T stands for time. What is our target date for meeting the goal? Different types of data can be measured during a PIP. Outcome measures affecting resident health and well-being are things like improvement in function, patient satisfaction, etc. Process measures involve improving steps in a system. Examples of process measures include number of residents receiving a TST on admission, number of incontinent residents on a toileting plan, or measuring the temperature of food at the time it is served. Lastly, balancing measures identify when changes occurring in one part of the process impacts care in another area. An example of balancing measures is length of stay. A length of stay that is too short could result in the resident being rehospitalized after they discharge home. Before a change can be made, we need to know what the root cause of the problem is. Root cause analysis, or RCA, is the process of problem solving to get to the heart of the issue. Examples of tools for RCA are listed here. We will go over each one in the next few slides. The 5 whys is simply asking the question why until you get to the answer you are seeking. For example, resident satisfaction scores went down this quarter. Why is this? The feedback from residents is that they do not like the spring menu. Why is this? The residents report back that they want more choices. Why is this? Residents say they would like to pick from more vegetable options. Why is this? Residents say that carrots and peas are never offered. Why is this? The dining services team was not aware of the residents' desire for carrots and peas, therefore they were not included in the menu. Now that the 5 whys have identified the root cause of the problem, the team can respond in a way that is straightforward and effective by asking residents their preferences before designing the next menu. Flowcharting is a way to examine the steps to a process by outlining them visually. The Bethesda Hypoglycemic Protocol flowchart is an example of this. This flowchart tells the nurse exactly what to do if a patient's blood sugar is low. Not responding appropriately to this situation can result in harm to a patient. If there is a process breakdown, we can follow the flowchart to determine exactly where the breakdown occurred and make corrective changes in the future. Fishbone diagrams help us look at a breakdown in a process to determine cause and effect. Here we have an example of a fishbone diagram for why someone might be late for work. Reasons fit into several categories. By laying out all the possible reasons, you can begin to figure out which one of these is the root issue or problem. Let's look at a nursing example of patients getting an unusual amount of bed sores or pressure injuries. There may be several causes: weight loss, turning and repositioning schedules, lack of skincare, etc. Diagramming these on paper helps us to see all the areas we need to improve in. It also helps us figure out what issue or issues might be the root cause of our problem. FMEA, or Failure Mode and Effect Analysis, looks at a potentially risky process to identify what areas or steps in the process may be of risk to residents. One example of an FMEA project is implementation of a new electronic health record. Once the process is laid out, the team members identify where the process could break down and cause harm. For example, the step of transcribing all medications into the new system could involve data entry areas, and that may cause harm to a resident. Committee members would be assigned to that specific step to come up with a way to prevent that step from causing issues to residents. Regardless of the method used to perform a root cause analysis, the steps to a PIP are always the same: plan, do, study, and act. PDSA cycles can be repeated until improvement is achieved and sustained. Improvements in one neighborhood can be expanded to other neighborhoods. Are you ready to try implementing QAPI process on a non-nursing issue from start to finish? Let's pretend we need to improve the process for how we keep the parking lots free of ice and snow in the winter. Clearing the ice and snow away improves quality and safety by preventing accidents and injuries and making it easier for staff, visitors, and ambulances to access the building. Before we can begin our process improvement plan on keeping parking lots free of ice and snow, we need to first identify that there is a need for a process change. Let's say, for example, we have observed a pattern of increased falls in the parking lot. A committee of people has been selected to look at the overall process for ice and snow removal and determine the root cause of the increase in slips and falls. The committee decides to use the 5 whys to figure out why there is an increase in falls. Why is there an increase in slips and falls? Because there is snow and ice on the ground. Why is there snow and ice on the ground? Because the snow and ice was not cleared off adequately. Why was the snow and ice not cleared off adequately? Because there was only one staff member clearing and they could not get the whole parking lot clear in time. Why can one staff member not get the parking lot clear? They do not have the proper equipment. Why do they not have the equipment? Because there used to be a company that removed ice and snow, and now it's just one person. It is determined that the root cause of ice and snow on the parking lot is the groundsperson's inability to get the job done and the need for better equipment. The committee plans to initiate a request for the proper equipment for snow removal. This is plan in the PDSA cycle. The request is reviewed by persons in charge of equipment and budgeting, and the request is approved. This is due in the PDSA cycle. The snow removal equipment is purchased and the process is studied to determine if this solves the problem. The ice and snow in the parking lot is monitored and data is collected on slips and falls. The data is studied and compared to earlier data to determine if the issue has resolved. This is study in the PDSA cycle. Due to the fact that the PIP was so successful, the community has decided to examine snow removal processes in their other buildings to see if process change should be expanded to improve safety in other locations. This is ACT in the PDSA cycle. By now, you have seen how quality assessment and performance improvement impacts residents and staff in your community. You should be able to recall elements of QAPI, such as design and scope, governance and leadership, data systems and monitoring, PIPs, and systematic analysis through PDSA cycles. You should know about some of the problem-solving methods we use to get to the root cause of the problem. Test your knowledge with the quiz after the completion of this slide.